Hello, I'm Dr. Heisler with the Houston Area Safety Council and Global Health. You know, there's a lot we still don't know about the new coronavirus, but there's a lot that we do know. Firstly, this virus is transmitted the same way that other viruses like the flu are transmitted, through respiratory droplets of someone who is infected, and it appears that it is spread from person to person if you come in close contact with that infected individual. Well, what do we mean by the term close contact? We typically say within 6 feet of someone, and that contact needs to be for several minutes, usually not just someone passing by. You can also become infected if you get infected droplets on your hands and then touch your face, nose, or mouth. This is why the number one thing you can do to avoid catching the virus or any other virus is to keep your hands washed and avoid touching your face with your hands. The topic of masks is heavily discussed on the news, but to reiterate, what we know is that wearing a mask is not recommended for healthy individuals. Masks are to be used on infected individuals so they do not spread the virus that they have. Not only are masks not recommended for healthy individuals to wear, to the contrary, it appears that they can also increase your risk of catching the virus because wearing a mask is typically uncomfortable and your chances of then touching your face are increased. You'll want to scratch and move the mask around, and if you do happen to have the virus on your hands, you've then introduced it to your face. Keep your hands washed, avoid being around someone that you know has a fever or is coughing, and if you yourself are sick, try to stay home or seek medical care. But avoid going to work and potentially getting a coworker sick. There is still a lot that we do not know about this virus, but what we do know should keep us healthy. Luckily, the major scenarios in which you would have an increased risk of exposure are if you have traveled to one of the hot zones, such as China, Iran, or Italy, or if you have been around someone that has the virus. For up-to-date information regarding this rapidly changing virus, feel free to contact us directly or refer to the CDC's website. Thank you.